Welcome to Medicosis Perfectionalis. Our topic today is Plummer Vinson syndrome. Plummer, that's why you have here a plumber. And by the way, there is an excellent mnemonic on Plummer Vinson syndrome coming next video, which will make this disease memorizable in a minute. And you will remember it forever. So what is Plummer Vinson syndrome? Syndrome means a group of symptoms that occur together. These symptoms are glossitis, which means inflammation of the tongue, chelosis, lips, dysphagia, difficulty swallowing, esophageal webs, iron deficiency, anemia. So the symptoms will be burning sensation of the lips from the chelosis, cheilitis, burning sensation of the tongue. This is glossitis, atrophic glossitis. Beefy red tongue, because when we have atrophy of the papilla, the superficial layer of the tongue, it will reveal the underlying layer. And the tongue is rich in blood vessels, like a lot of blood vessels. Dysphagia, which means difficulty swallowing of solids, not liquids, due to this esophageal webs. Liquids can pass, but solids are larger, so they get stuck. The difference between a web and a diverticulum is that a web is an inward protrusion to the inner side of the esophagus. The diverticulum is to the outside, is an outpouching. Also, we have iron deficiency anemia. And you can review iron deficiency anemia if you click here. The complications of Plummer Vinson syndrome include precancerous lesion. Plummer Vinson syndrome is precancerous. Why? It can lead to cancer in the tongue from the glossitis, the hypopharynx or the esophagus from the esophageal webs or strictures. How to diagnose Plummer Vinson syndrome? Clinical symptoms. Symptoms in the lips from the cheilitis, like burning sensation, the tongue, burning sensation in the tongue, beefy red tongue, and symptoms of anemia. We have iron deficiency anemia. Anemia symptoms include tired and pale, pale and tired. Sometimes I have angina, sometimes I can get murmur. Also we have dizziness, we have exercise intolerance, we have fatigue, drowsiness, etc. Also we can do anemia workup. Here we are suspecting iron deficiency anemia. You will have low MCV. Also you can do the iron studies, and you can review all of this in our previous video of iron deficiency anemia. Imaging modalities will include barium esophagography to see the rings, the webs or the rings, video fluoroscopy, the same thing, esophagogastroduodenoscopy, very short word, took me a minute to write it. So these are modalities. It's an endoscopy that will go inside to see these rings, structures or webs, etc. You can do a biopsy of the oral mucosa. You will see epithelial atrophy, submucosal chronic inflammation, atypia, dysplasia. No wonder why it's a precancerous lesion. I'm talking atrophy, atypia, dysplasia for a long time, of course, can lead to cancer. How to treat Plummer Vinson syndrome? Since it's an iron deficiency anemia, give iron. There are esophageal webs or rings. You can do dilatations of the esophageal webs. Prevention is easy by getting iron, good diet and exercise, and the prognosis is excellent by giving iron supplements and dilating the esophageal webs. Take care, it's precancerous, so you should follow up the patient. And that's it. Please stay tuned for the next video, which is a mnemonic on Plummer Vinson syndrome. You will absolutely love it, I'm certain. Thank you very much for your support, and see you in the next video. Consider hitting that subscribe button. Thank you.